Welcome to HealthDesk channel. I am Dr. Srilekha from Happy Smiles Dental Clinic. I am an oral medicine and radiologist, in short, a dentist. The teeth should be taken with utmost care because they are the gateway to our whole health. Today I am here to educate all of you regarding the common problems which we face in dentistry. One of the most disturbing problems because of these gum diseases is loosening of teeth. Did you observe that many people complain that they are not able to chew their food properly because of mobile or loose teeth? These gum diseases, if not resolved, they progress deeper and cause the teeth to loosen and eventually fall out. So what is the solution to prevent this gum disease and as well as prevent the loose teeth from occurring itself? The foremost thing is resolving the gum diseases in the initial stage will help us a lot. And second is, when you go to a dentist, just get evaluated the whole teeth as well as the teeth sockets. When they evaluate, the dentist will inform you whether this particular tooth, either in a particular area or the whole of the teeth are affected, do they have pockets or there is any bleeding on touching. So this all indicates that there is a progressive gum diseases already present in your mouth. So once this is detected, this can be resolved by a simple cleaning or a flap surgery might be required sometimes. What is a flap surgery? The flap surgery is we remove a little part of we elevate, not remove, but we elevate a particular part of your gum. We clean it from beneath the gum level, all the calculus which is present on the tooth surface. A certain part is seen in the oral cavity, but a certain part is hidden away from our eye. This is flap surgery, wherein we elevate a part of your gum wherever we feel it is necessary. We clean it from deep within and we stitch it back. This helps in maintaining the oral health and also the gums will eventually strengthen back and hold the teeth tighter. This prevents bleeding as well as loosening of teeth in the early stages. The third treatment is we do splinting. What is splinting? Splinting is we put a wire around your teeth, whichever teeth are loosened, and we tie them together along with the most supported and the strong teeth so that eventually the loosening will harden as well as the teeth will be strong enough in their sockets. This splint is placed for a period of 3 months to 6 months to 1 year based upon the type of mobile or the loose teeth the patient has. So all these problems can be resolved if the patient comes in the early stages, that is when the teeth are started moving or the teeth have bleeding problems or the patient has observed that he is not able to put pressure. But once teeth fall out, what should the patient do if the teeth have already fallen out? Teeth fallen out, first before replacing them needs gum corrections. First the gum whichever is diseased has to be resolved through flap surgery or cleaning, and then the fallen teeth should be replaced by new prosthesis or new teeth. So whenever we visit a dentist, we should never omit the factor or we should ask him particularly what particular problem do we have or are there any pockets present between the teeth. So next time when you visit a dentist, just keep in mind that not only the oral cleaning is essential but also the evaluation of each and every particular tooth is necessary by the dentist and a detailed report should be given to you. Thank you.